Phase 3, Stage 3, communicate your scope of practice. This particular stage is important to prepare you, especially if you're a newer practitioner, if you're a student, or if you're changing settings, right? What are you going to walk into? It's important to prepare for different opinions about your profession, about your scope of practice, about what you do, right? There is oftentimes a lot of concern when a student comes into the clinical realm for the first time and they say to themselves, wow, I wasn't prepared for this. Wow, I did not expect to be met with so much um, disrespect, right? Where there's comments made by almost everybody in the profession, and you know, within the profession, it's not that every single person shows occupational therapy disrespect, but there is a lot of times you're going to feel like, wow, I don't think that I am respected for having this degree, having this license. So that's what we're going to talk about. We're going to learn how to communicate the value of our scope of practice to other professionals. It's a way to provide a reality check. There is a difference between the way the clinical realm is often described in academia and how academia actually is. And so I think it's important for us to face that reality. During our academic journey, we were taught that the sky's the limit, that as occupational therapy practitioners, we possess the tools to make a profound impact on people's lives. That is true, right? However, upon entering the real world of practice, we often find our scope constrained, leaving others unaware of the transformative work we can truly achieve. You see it in skilled nursing facility, especially when we are reduced to ADLs and activities, and people often, make jokes or sidebar remarks about our profession, which you're going to see in the next several slides. It's tough. Our scope is constrained. People say, well, you're not supposed to do that. That's PT. That's PT's job, or that's speech therapy's job, or no, you have to leave that to the social worker, right? When we're taught to be all of these things to our patients, and when we get out into the real world and we're reduced to activities of daily living, which is one of 9 different occupational categories that in which we can work, it is really difficult. So how do we advocate for our profession? That's the question. How do you communicate your value to other professionals? First, you understand and prepare for the common misconceptions and barriers you will face as an OTP in the medical model. You use the language of the OTPF to rehearse your responses, and you know how to respond in the event that another professional begins to overstep. You see here, I will always recommend that you have a hard copy of the OTPF. It is pricey. That just is what it is. But I think it's important to invest in that. If you do not have a copy of an OTPF and you are a practicing occupational therapy clinician, you are not doing yourself any favors. So please do just take the time to go and purchase that because it's your profession. It's a guide for your profession. So please do that. There's also a PDF that you can download, Protecting Professional Autonomy. So these are some tips that you can follow to protect your autonomous license, remembering that you are allowed to make the clinical judgments of your patients. Your name, your license is on the line. Nobody else's. It's just you and the medical doctor. So between you and the medical doctor, those are the only 2 people involved in your plan of care. And of course the patient, right? It's a trifecta. Nobody else should be influencing how you write your evaluations, how you treat your patients, what interventions you use, and how long you treat them, or your recommendations for discharge. They are yours, entirely yours. So please do protect yourself. So professional scenarios, common misconceptions. This is a disclaimer. The following scenarios are not contrived, which means I didn't make them up. I am not fabricating this information. These are comments that I have collected over my years of occupational therapy experience in many different settings. Many times I was dumbfounded. It was difficult for me to respond in the moment because I was not prepared to face these thought patterns of others. And I want you to be prepared. So, again, this is not me trying to stir the pot. This is me truly, from the bottom of my heart, seeking to prepare and equip occupational therapy practitioners to face some of these comments and be prepared to respond instead of react. Because when we're faced with, when we're in the moment, it's very easy to just kind of, let it rest on our shoulders and not do anything about it. And it impacts us and it impacts our mindset and it increases our imposter syndrome. So we have to practice. We have to practice these things so that we can get better at communicating and responding to them. So some personal examples. This is not a complete list. The complete list is in the Connect Mentorship Handbook, but here are some. So these are comments from speech therapy. You can't work on cognition. It's not in your scope of practice. Why did you include feeding on your plan of care? Your scope of practice doesn't include swallowing. Occupational therapy has no place in working with aphasia. That is a domain of speech only. I'm not going to comment on these. I'm just simply reading them so that you can get a feel of what scenarios are available to you. I want you to comment on them. I want you to critique. I want you to respond. I want you to maybe tell us how, if there's a difference between reacting to something like this and responding to something like this. Maybe initially, immediately after reading something like this, you react versus taking a moment and trying to construct a response to it. I would like to hear your process. What did you think when you first read it or heard it? And then how did you grow from that? And, where did you end up with that? Physical therapy. So during a co-treatment with a patient who is unable to stand dynamically for more than 5 minutes, the physical therapist said, "Can you follow with the wheelchair and oxygen while I walk her?" During a co-treatment with a patient with a max assist to sit unsupported, I'm going to work on support and holding the patient. Do you want to get your cones or the clothespins with the mirror? For a patient able to walk 100 feet but unable to sequence an ADL routine, during discharge meeting, the physical therapist states that the patient is ready to be discharged, but you are working on backward chaining and motor learning for self-care. So how would you respond to that? If the PT openly in your meeting is saying, nope, they're ready to be discharged, and you're working on backward chaining and motor learning for self-care, how are you going to advocate for your patient? You overhear the PT talking to a patient. So this is what I overheard. We are going to work you out hard and then you can take a rest over at OT. Maybe they will let you fold their laundry again. These are some comments coming from social work. You aren't a psychologist or a psychiatrist. You need to leave behavioral health to someone who knows about that. You did not learn group and family processing skills. Only social work is trained in helping family dynamics. Occupational therapy should not address coping skills. That is outside of their domain. An occupational therapy practitioner wouldn't qualify for a case management certification because they have not met the requirements necessary to work within the social model of healthcare and help others manage their health and life needs. Some examples from nursing. We are short-staffed and all the patients are max assist in self-care. Whose ADLs will you be doing this week? Next example. You don't have any more patients? We are going to need you to fulfill CNA responsibilities. Next. You don't need to pick him up for therapy. He has dementia and just wanders around. And finally, can you pick her up for therapy? She gets bored and wants to play games and such in the OT gym. Last category is medical doctors. We don't refer to occupational therapy. Our patients need to get stronger. They can get to the bathroom all by themselves. You don't need a referral to occupational therapy for premature onset of fatigue during activity. PT trains endurance. OT does the upper body and PTs do the lower body and general mobility. Occupational therapy doesn't do cognitive remedial therapy, so we only send the referral to speech therapy. We don't send referrals to rehab after giving them a chronic illness diagnosis. Our patients only need a handout of exercises and they're fine. So that brings us to the fourth challenge. The fourth challenge of communication is to create at least 3 responses to 3 different scenarios when the occupational therapy scope of practice is questioned. You may use your own experience, or you can use one of the experience provided in this chapter. And then it gives you some directions of how to get there, which you should be very familiar with at this point. Remember that your hypothetical response should use language from the OTPF. That is our common language, and we should be using what we have available to us. Bonus, upload a video of your response. Please make sure that the video does not exceed 1 minute per scenario. Remember that stepping outside of your comfort zone and doing a video may really be a huge value for you. It may allow you to grow in ways that you didn't necessarily plan for. So consider doing a video to answer the requirements of this fourth challenge. Okay, before we end this particular stage, I want to make a note on professional bullying. Facing ridicule, infringement, and/or professional bullying can be challenging, but it's essential for occupational therapy practitioners to stay strong and continue to advocate for their profession. So, what are some tips when facing professional bullying? I did make a PDF of this that's included in this module. Feel free to print it out and keep that on you. These tips are really important. I think at some point along the way, we all face professional bullying sometimes. If you have not faced this and you don't know what I'm talking about, then I am so happy for you. I am genuinely happy for you. Unfortunately, I know that there is a large majority of you who go through this, and so I want to give you some tips. Number 1, know your worth. Remember that as an occupational therapy practitioner, you possess valuable skills and expertise that positively impact the lives of your patients. Stand tall and be proud of your profession. Number 2, seek support. Reach out to colleagues, mentors, or professional associations for support and guidance, or your cohort in Bot Portal. Connecting with others who understand your challenges can provide you a sense of belonging and validation. Number 3, educate others. Take the opportunity to educate those who misunderstand or undermine occupational therapy. Sharing knowledge about the profession can help dispel misconceptions and foster respect in your place of work or at school. If your professor, right, so if your professor is the one that you feel this applies to, the same thing can be true. So keep that in mind. Number 4, be confident in your scope. Know the boundaries of your scope of practice as defined in the OTPF-4. Confidence in your abilities and limitations will strengthen your advocacy efforts. Number 5, use professional language. When responding to ridicule or infringement, draw upon language and communication strategies from the OTPF. Speaking with authority and clarity will assert your professional expertise. This is why I stress knowledge. This is why I stress reading. This is why I stress listening to other people speak about topics, because the more you listen, the more you take in, and the more you make it part of your language, your lexicon, the more you improve your vocabulary and you improve your style of communication, the easier it will be to adjust to professional language and to speak with leading with professional expertise. Number 6, document incidents. Keep a record of any incidents of professional bullying or degradation. Document dates, times, and individuals involved. This documentation may be useful if further action is needed. By keeping records of these scenarios and or forwarding these incidences to AOTA, you are doing your part to advocate for yourself and the profession. Number 7, practice resilience. Cultivate resilience and recognize that by facing challenges in an opportunity for growth. Perseverance and determination will help you overcome obstacles. Number 8, seek continuing education. Stay informed about the latest developments in occupational therapy through continuous learning. Strengthening your knowledge and skills will boost your confidence in addressing infringements. Number 9, set boundaries. If faced with undue pressure or demands that go beyond your scope of practice, assertively set boundaries and communicate your limitations. Number 10, celebrate your wins. Celebrate your successes and the positive impact that you make on your patients' lives. Remind yourself of the meaningful work you do every single day. Celebrating your wins is so important. Taking time to come back to the community space and in the general, board, even if it's in the Q&A board, sharing your victories and allowing us to celebrate with you is so important, and it goes a long way. Number 11, don't internalize negativity. Remember that the negative attitudes or actions of others are not a reflection of your worth as a professional. Focus on your own growth and progress. Number 12, lean on your passion. Reconnect with the passion that drove you to become an occupational therapy practitioner. Let the passion fuel your advocacy efforts and commitment to your profession. 3 more. 13, stay true to your values. Uphold the values of occupational therapy, such as client-centered care, advocacy, and ethical practice, even in challenging situations. Number 14, seek professional resources. Utilize resources from your professional association to navigate challenging situations and advocate for the profession. And finally, embrace growth. Facing adversity can lead to personal and professional growth. Embrace the journey and use it as an opportunity to become a stronger advocate for occupational therapy. Okay, so you have these tips for facing professional bullying should you need them. But now I want you to head to the 4th challenge and complete it. I look forward to seeing what you have to say regarding these scenarios. And I will see you in stage 4, which looks a little bit differently because it is a webinar that I filmed. So it doesn't have the same format of the videos you've been watching. So please do ensure that you're looking in the bottom part of the module to see if there's any challenges associated with that stage. See you in stage 4.